Okay, so Louisiana's dealing with a terrifying surge in flesh-eating bacteria cases, right? Let me break this down. Imagine going to the beach on a hot summer day, wading into the ocean, and suddenly your skin starts literally rotting. That's Vibrio vulnificus in action. 9 infections, 5 deaths this year alone. 5 dead. And officials are scrambling to warn people. But here's the kicker, this isn't just a random health scare. It's a symptom of something way bigger and scarier than most realize. Let's talk numbers first. Louisiana used to average 7 cases a year. Now they've hit 9 in 2026, with half those people dying. That's a 50% mortality rate. Let me repeat, half. What's causing this spike? Well, officials blame warming waters. Vibrio thrives in warm, salty environments, and climate change is turning the Gulf into a bacterial buffet. But here's what they're not saying, this isn't just a Louisiana problem. It's a global red flag. Cases are popping up farther north now, Maryland, New York, even Maine. The ocean's warming, and pathogens are expanding their real estate. Now, I'm not a doctor, but this feels like a horror movie plot. You get a tiny cut while swimming, and suddenly your body's at war with a bacteria that eats flesh faster than surgeons can cut it out. And the worst part? Most people don't even know Vibrio exists until it's too late. There's a dangerous gap in public awareness here. We're warned about sharks and riptides, but not about microscopic killers in the water. That needs to change. But let's zoom out. This isn't just about one bacteria. It's about how climate change is rewriting the rules of disease. Warmer temperatures don't just raise sea levels, they create new highways for pathogens to spread. What happens when diseases once confined to tropical zones start appearing in places like Canada? We're not ready. Hospitals up north might not even test for Vibrio, leading to delayed treatments and more deaths. And here's another angle. Why are we still surprised by this? Climate models have predicted these shifts for decades. Yet, our public health systems are playing catch-up while the planet burns. Maybe the real infection here is denial. We keep treating these outbreaks as isolated incidents instead of interconnected crises. So, where does this leave us? I'm not saying avoid the ocean forever, but maybe check the water temperature before diving in. Or push for better local monitoring programs. Because here's the truth, Vibrio isn't the only threat lurking in warming waters. This is just the first act. What happens when the next bacteria or a new virus emerges from melting permafrost or displaced wildlife? The script's already being written. The question is, will we read it before the sequel hits?